现代社会当中，近视呢几乎成为了全民的困扰，尤其是在华人群体当中，高度近视的比例呢在不断上升，整体近视概率高达84%，不仅会影响生活质量，还会带来一系列的眼部健康风险。那传统的近视矫正手术，比如说像 LASIK， 它其实并不适合于所有人。那所幸呢，在这2年有一项叫做 EVO ICL 晶体植入的先进技术，正在为那些有高度近视的这个患者呢带来更多的选择。那今天呢，我们节目邀请到的是 Fraser Valley Cataract Laser Center 和 BCLASIK 创始人 Dr. Gabriel Chu， 他是目前全 BC 省手术案例最多的视力矫正专家，也是不列颠哥伦比亚大学 UBC 的现任教授。他的手术中心呢是大温哥华地区规模最大的视力矫正机构之一。那今天的 Dr. Chu 将会为我们深入讲解 EVO ICL 的技术原理、适合的人群，还有术后体验。Hi, Dr. Chu, thank you so much for joining us today.
Hi, Leah. Thank you.
First, could you please brief introduce yourself? I'm Dr. Chu, blah, blah, blah.
Yeah, I'm Dr. Gabriel Chu, and I'm the founder and one of the main surgeons at BC LASIK, as well as Fraser Valley Cataract and Laser. I've been working in Canada, British Columbia, for approximately 16 years, specializing in lens-based surgery, as well as LASIK.
Great. So we're talking about the EVO ICL. So EVO ICL, of course, is one of the refractive surgeries that we know for these past 2 years. And could you please explain what is the differences between EVO ICL and LASIK and PRK, and why it can be considered as a premium solution?
The great thing about EVO ICL is we started to specialize in this because it's very different from laser, like LASIK or PRK. And what do I mean by that? Well, it's because EVO works in an entirely different way than laser. For example, laser treats the cornea, which is the front part of the eye, whereas EVO ICL doesn't treat the cornea. It preserves the tissue of the cornea, especially important for patients who have irregular corneas or who do not qualify for laser. For example, they have thin corneas or high prescription or dry eyes. The second thing is that the EVO ICL can be completely reversible and removable. So laser cannot. Once the laser is done, it cannot be reversed. Third thing is that if you have any dry eyes or any irritation to your eye, then laser potentially could make it worse, whereas EVO ICL is better to reduce the irritation or dry eye. There's also a reduced risk that over time it can lose its effect.
So I also heard there's something called a higher order aberration. It could be happened in LASIK surgery, and the results actually cannot be corrected by glasses. So does EVO can prevent that, to have the higher order aberration after procedure?
That's very true, Leah. I'm glad you brought that up, because laser can increase higher order aberrations. And what do we mean by that? It's because of the different way it treats the prescription. For example, higher order aberrations can make the vision a little worse, or make your night vision a little bit worse, or it can increase glare. Because the lens is put right inside your eye, it will not increase as much your higher order aberration, so it can correct for your prescription without having to increase these issues that we don't want.
Got it. And also there's a latest lens called the EVO Plus. Actually in China it's called the 5th generation of the EVO. So EVO Plus actually is an upgrade version of EVO lens. So what's the difference?
Yeah, the great news about EVO Plus is it's exactly the lens that we would like to use. It has a larger, what we call optical zone, so it allows for us to correct for more prescription. It allows for a larger zone, meaning a pupil size, so you have reduced side effects from night vision, like glare and halos. It gives you better peripheral vision, and it also can correct for higher range of myopia, especially for our Asian patients who do have a higher prescription.
Got it. And Canada actually is one of the few countries there where ICL is approved for treating farsightedness, and we just simply cannot do that in the US. But Canada, you can actually have EVO for farsightedness. Could you please share how the lens work differently for hypomyopia and what kind of the patients benefits most?
Well, thank you for pointing that out. We do regularly have many patients from the US come to Canada for the treatment of hyperopia. And what does that mean? It means that patients who have a very far-sighted prescription, meaning a plus prescription, that is not approved with EVO ICL in the States. So these patients, in order to get their EVO ICL to fix their farsightedness, they have to, the closest country they could go to easily is Canada. So we have lots of patients coming from the States to Canada to get that fixed. Is it generally harder to fix hyperopia with LASIK? Yes. And this is why we choose EVO ICL, because they do a very good job with a very high success rate of treating farsightedness.
Got it. And let's talk about Asian eyes. We know the precise measurements are very critical for ICL good outcomes. And Asian people, we just have smaller eyes, narrow interior chambers. And how would you select the right lens to ensure the safety for those Asian eyes?
So we follow very strict measurement criteria for fixing narrow angles or shallow anterior chambers, just for better safety. This is why we screen our patients very well. So we will do a number of tests to figure out how is your eye, how narrow is the chamber, and can we improve your success and safety? And we will only do those eyes that allow us for the highest safety and the highest success.
Got it. Thank you so much. And in the previous ICL lens version, the IOP stability and the cataracts from your earlier actually had been the concern, but the EVO lens actually, because they have the hole in the center, so it actually solved the problem. Tell me about the hole. How does it work to make EVO ICL surgery more safe?
Yeah, it sounds a little scary when you have a hole inside the lens, but let me tell you that the improvement in the ICL is by making a very small, barely visible hole inside the lens. And how that improves the safety is it allows for better fluid flow inside your eye. There's a natural fluid flow inside your eye, and when you put a large lens inside the eye to fix the prescription, sometimes that flow can be interrupted. So in the past, we used to have to do laser holes to try to improve the fluid movement, to try to prevent something like glaucoma. Because the lens now has a built-in hole for drainage, and you don't really feel it or see it, it allows for improved safety, and it also allows us not to have to do any laser prior to doing your EVO lens.
Got it. And also, because EVO have the toric lens, which means you can correct astigmatism, but actually putting the toric lens in a normal lens, they are different. So high prescription of the astigmatism could be tricky. So what is your experience in optimize outcome for patients with high astigmatism?
So people with high astigmatism is quite common, especially in my Chinese patients. So very often, high myopia and high astigmatism can go together. And if you fix the myopia, nearsightedness, without the astigmatism, the sangguang, then sometimes we can still have blurry vision. So we really, really want to pay attention to astigmatism. The great news about the ICL is that we're able to fix the astigmatism right in the lens, all in one step. Because these lenses are customized, we're able to put the astigmatism in the lens and put that right into your eye. How does that help? Well, it helps because it's very accurate, number one, because it's custom. But also, number two, it's got a very high stability because we will size the lens properly to make sure the astigmatism correction is very stable. There are other ways to fix astigmatism, and we can talk about that. But I think with a custom lens is probably the best way that we can do that.
Got it. Thank you so much. So you talked about before, LASIK actually for the past years, their prescription may a little bit come back, the regression rate, but EVO can last longer. But still, people wanted to know what will happen to me eventually when I got cataracts. So any ideas on that?
Yeah, so, we like to do EVO ICL in patients who are younger, right? As young as maybe 20 or 21 years old. And the good news about that is that the EVO lens lasts forever, meaning as long as you're alive, it will last, okay? And the regression rates for prescription is very low, which means the lens itself will last forever. Now, a very common question is, when do I need eye surgery again? Well, when you hit around 65 years of age, naturally you will develop a cataract, liebai内障, okay? And when you develop a cataract, then we will require to remove this ICL and do cataract surgery to fix your vision. So at that time, we will see you again. So if you had your surgery, say, when you were 20 years old, and then you get cataract surgery when you're 65, that will last, 45 years. So quite a long time.
Right. Is this something like a one-time surgery? Like you can remove the EVO lens and replace the cataract lens just in one surgery?
Yes, it is. Yeah, it's all done at once. So there's minimal downtime and it's a very quick and easy surgery.
Got it. And one of the benefits of EVO is actually it's reversible, it's removable. The lens can be removed, but none of us wanted the lens to be removed in the first year, right? Because that's just, although my eyes will go back to how does it look like originally, but we still want the lens to be inside of the eye. So what is your removal rate and how would you keep people feel happy about EVO?
Yeah, so one of the greatest benefits of EVO ICL is that it's removable, which means that if you don't like it, if the results rarely are poor, if something else is wrong, meaning there's a very rare complication like glaucoma or cataract, we will remove it. So the removal rate is probably less than 0.6%. So we rarely remove these lenses. But the good news about EVO lens compared to LASIK is that once we do the LASIK, it's not reversible. But the lens, we can very easily remove in about 10 minutes or so.
Got it. And you actually had a PRK because you had high prescription, but by the time the EVO lens has not become out. So what would you do if you have the chance to choose again?
That's a very good question. If I can rewind time, maybe 10 or 15 years before, if the EVO Plus lens was available, I definitely would pick an EVO ICL lens for myself. Unfortunately, I also had PRK at that time because that was the only available thing. And when we talked about irregular corneas, I actually had a thin cornea.
Oh.
So EVO ICL would have been perfect for me. So if I were to rewind time, or maybe fast forward time so that I was talking about that surgery today, I would recommend for myself an EVO ICL.
So tell me about your vision correction story. Like, what prescription did you have and what is the surgery like? Who did your surgery?
So I trusted my partner, Dr. Joseph King, to do my surgery. I'm an eye surgeon myself, so it's very important for me to have very good vision. And I was very nervous about it. But I was also very motivated because I've been treating patients with high myopia, especially my Chinese and Asian patients. And I myself had about a -6 spherical prescription, as well as about 2 diopters of astigmatism. So I had 2 things I had to fix. And of course, I trusted Dr. Joseph King, who did a great job. And even today, I'm free of glasses.
That's wonderful. Congratulations. I had -13 diopter and I had EVO lens myself like 3 years ago. Yeah, right after FDA's approval, and it just completely changed my life. So I kind of feel like this is one of the best decisions that I've ever made in my life. And I just wanted to do it earlier, but even before that, FDA has improved. So just everything right on time. If I can choose again, I would choose EVO for one more time. And I think if you have not even like a high prescription, if you have a moderate to like high, if you don't want to remove your cornea, if you're just worried about the surgery, I just don't want something to be removed. I want to do something that can be removable, it's reversible. Then I feel like EVO ICL is a perfect solution for you. Thank you so much, Dr. Chu, and thank you so much for our audience are paying attention to that. 感谢大家继续关注我们的节目啊。那如果大家感兴趣的话，我们来导播老师放一下我们屏幕上的二维码，大家都可以扫描这个屏幕上的微信二维码，或者添加微信号 BCLASIK 来进行免费的中文咨询。那尤其呢是在BC 省啊，咱们的这个视力讲中心呢是最大的，而且是最有经验的。那么如果大家去的话呢，记得要带好自己的这个保险卡，然后呢，在这个前面的手术费用的这个检查部分呢，大家就是不用花钱的哈。那大家详情呢可以去更多的了解一下，扫描我们的微信二维码。那我们在下期节目当中呢，将会讨论针对于尤其45岁到50岁以上人群的这 Cataract 以及老花眼方面的问题，以及最新的一些晶体技术。感谢大家继续关注，我是主播莉亚。Thank you so much, Dr. Chu. See you next episode.
Okay, thank you. 谢谢你。
Thank you. Bye bye.